Good afternoon, everyone. I think we'll get started, and as folks join, they can listen in. Thank you for coming to today's panel discussion on supporting young parents in foster care. My name is Catherine Kuhns, and I'm a researcher at the Urban Institute. Today's event is a culmination of much of the work my colleague Amy Dworsky and I have conducted over the past 2 years on building a learning agenda on expecting and parenting youth in care. When we started this work 2 years ago, the goal was to identify and prioritize the gaps that future research and evaluation activities could begin to fill. Soon, Amy will share more with you about all of the activities that we carried out to build the learning agenda. We hope today will serve as a springboard for continuing the conversation on this important topic, along with the help of our excellent panel members who we will introduce soon. Before we get started, I'd like to review a little housekeeping. The event is being recorded and the recording will be posted online afterwards, so feel free to share this with anyone who you know missed it and might be interested. There will be a live transcript at the bottom of the screen. If this is distracting to you or you prefer not to see them, you can use the hide captions or adjust settings with the live transcript button. All participants are muted, but you can type your questions or comments into the Q&A box at any time. And a note that we will be taking audience questions at the end, so please feel free to use that throughout the conversation today, and someone will be monitoring that box. Please do take 1 or 2 minutes to complete the survey at the end of this event for our events team. And lastly, if you have Twitter, engage with us online during the conversation or after using #live@urban. Now, to help frame our discussion today, I'd like to take a moment to highlight that this research is part of a larger body of work we conducted at Urban on building the evidence base for young people transitioning out of care and into adulthood. To do that, I'd like to introduce Mike Pergamit, Senior Fellow at the Urban Institute and one of the primary investigators who leads this body of work, to share more. Mike?
Thank you, Catherine. And hello, everybody. Add my welcome to Catherine's for joining this webinar. And as Catherine said, I'm Mike Pergamit, and that I'm a Senior Fellow at Urban Institute. And this work is part of a larger project that we do for the Administration for Children and Families on various aspects of helping youth make the transition out of foster care. Mark Courtney, who's a professor at the University of Chicago, and I are the co-principal investigators of the overall project. And this is the 4th webinar in a series. So earlier this year, we hosted 3 other webinars. We did one where we looked at helping young people who are currently and formerly in foster care be successful in college, where we examined the CETA Scholars Program at Western Michigan University. All these webinars are posted, both the slides and the video are posted on the Urban Events website. And the CETA Scholars, there's a report behind it that is also on the Urban website. A second webinar then was on use of education and training vouchers and whether these vouchers lead to increased enrollment and persistence in post-secondary education. There will be a report coming out on that more early next year sometime. And then our 3rd webinar was looking at 2 programs that use very different approaches to help young people move into the labor market. The report that's behind that webinar, it's currently posted on the ACF website, and it should be posted on the Urban website hopefully later today, if not probably tomorrow. So in addition to those topics, we have some others that are still going on. One is we're looking a lot at housing issues, one on looking at how HUD's family unification program is used to help youth when they transition out of care. And we're also looking at some models of supportive housing, those that use the housing first principle and provide supportive services for youth who are out of care. And a report on that is probably also due sometime early next year. And then finally, we also have developed a learning agenda for what we need to learn to serve young people to even older ages, because now Chapin dollars can be used to serve youth up to age 23 if you have extended foster care. And so I would add, there's a brief out on that that's also posted on the Urban website. And both housing and how to serve youth to age 23 are both relevant. Actually, all these topics are relevant even to today's topic, because serving youth in care or who are transitioning out of care, who are parents. All these issues apply to them, as well as some others that are particular issues for youth who are parents. And so that's what we're going to talk about today. Most states do have some form of extended foster care, which has therefore increased dramatically the number of young people that the child welfare system has to serve who are parents. And so we really need to understand how to best support them and their children. So I'm looking forward to a great discussion today. I want to thank you again for joining us. I will now introduce Amy Dworsky. Amy is a senior research fellow at Chapin Hall at the University of Chicago and a member of our research team. Hello, Amy.
Hi, Mike. Thank you. And yes, I'm going to talk a little bit about the background for this project and the methodology that we used. So first, why focus on the needs of parenting youth in foster care? One is that we know from research that young people in foster care have very high rates of early parenthood. And this is especially true in states that have extended care beyond age 18. And this really reflects the fact that the majority of young parents in care are 18 and older. We also know that services and supports are essential if young parents in care are to successfully navigate both the normative developmental tasks of adolescence and the adult responsibilities of caring for a child. At the same time, child welfare systems are really not designed to provide parenting youth in care with the services and supports that they need and that their children need. Next slide, please. So what did we do? We started by conducting telephone interviews with 2 groups of key informants. First, we talked to administrators from 10 public child welfare agencies in states with extended foster care. And second, we also talked with representatives from 6 programs that provide services to pregnant and parenting youth in foster care. We used those interviews and to identify topics that were related to the needs of parenting youth in foster care and developed a conceptual framework for addressing those needs. And then finally, we hosted a convening with our key informants, as well as young people with lived experience and other stakeholders to explore the topics that emerged from the interviews. Next slide. This slide shows you some of the key needs that the convening participants identified and that we'll be covering in today as part of our panel. First were supports for young fathers. Second, specialized training for caseworkers and foster parents. Third, assisting young parents with finding and paying for childcare. Fourth, mental health services. Fifth, equitable access to services regardless of age, race, ethnicity, gender identity, sexual orientation, or where in the state they lived. Sixth is inclusion when decisions that affect their lives are being made. And finally, decrease surveillance to reduce the fear that hotline reports and fear of hotline reports and child removal. And now I'll turn it back over to Catherine to kick us off.
Thank you, Amy. I invite the panelists to join me on camera now as well. Go ahead and show your video. Feel free to unmute. We'll just do quick introductions before we dive in. So today we're joined by Blanca Goetz, a Jim Casey Young Fellow, Kevin Walsh from the Illinois Department of Children and Family Services, Azar Webb, who's also a Jim Casey Young Fellow and will likely be turning on his camera in just a moment, and then Valerie Worthy from the Director of School Success and Children's Village. Welcome and thank you so much for joining us today. Hey there, Azar. So as Amy noted, our discussion will be following the themes we identified through our interviews, the conceptual framework and the convening. And we're going to kick it off right away by just diving in and starting with discussing the needs of fathers who are far too often left out of the conversation of expecting and parenting youth. So Kevin and Valerie, this first question is for you. In your experience, what strategies are effective for engaging young fathers, including non-custodial fathers, in services? Kevin, why don't you kick us off?
Great. Thanks for having me, Catherine. this is a very important to us and in Illinois. One of our key measures here is looking at identification, disclosure and identification, looking to young fathers in our system and encouraging them to identify as fathers and disclose that they are. That opens up a full range of services for young men in our system. In Illinois, youth are staying care till 21. And when we allow youth to disclose, we open up a variety of resources for them. Here at DCFS, what we do is we have what we call the Teen Parent Service Network. And anytime a youth is identified as parenting or expectant, they are intaked into a system where they get a variety of services. And for young dads, one of the most important things is paternity supports, establishing parentage and a co-parent plan, how we can engage youth to work on developing the co-parent plan with their paramour or their significant other, and then helping facilitate that communication about what that co-parent plan may be. When will the visits occur? How often will they occur? What is the financial support available to both parents? And then really focusing on fostering that visitation across any placement type. So making sure that our foster parents, our transitional living programs, our independent living programs, that they have policies that align with supporting fathers also, which means allowing the child to come into the home for visitation and supporting that. Once we identify a youth in need of parenting supports, we really want to assess what is their readiness to be in a caretaking role. Taking care of an infant, taking care of a toddler presents a lot of stressors and needs. So we're always prepared to put in parenting classes, parenting coaching, creating safe spaces for visitation. And along with that is also encouraging our dads to participate in trainings around safe sleep, on creating a youth-friendly or a child-friendly environment, providing budgeting around how to support yourself and how to support your child. And that is really, for us in Illinois, we drive all of that through our practice model through the child and family team meeting process. So all youth and all families participate in a quarterly child and family team meeting where that drives information about what's happening in the community, that drives information about needs and supports and strengths. And that all translates into a co-parent plan that we develop with young dads. And we help them to be the most successful parent they possibly can. So our main theme is come forward, talk to us, tell us about your experiences being a dad, and tell us what your needs and support are. And then when that happens, that opens up an array of services. So really the engagement is the disclosure, the identification, and the trust that you will get the help you need.
Okay, yes, Kevin, well said. It's with any young man who is a parent, male engagement work is hard and requires out of the box thinking. Like the conventional approaches often alienate young males because of short-signed initiatives that tend to evade upon their privacy. So today's young fathers need information that is tangible and is easy to absorb, so to speak. They need to be reassured that their personal information won't be shared, because that's huge with them and with any other child support agencies. Meetings being offered on group or individual formats that take place during the evenings so that the young fathers have the ability to go to work and be responsible. These meetings should be supportive, interactive, and also should be something that is punitive for the young person. Offering meals and snacks during these meetings are a way to appeal to the young fathers. Considerations of also have to be made for digital world, because that's what we currently live in today. Here at Inwood House, we have several different parenting programs, one of which is a Young Fathers program, Inwood House here in the Harlem, New York area. And it addresses several factors with young fathers, one being the relationship factor, the quality of the father's relationship with the child's mother, including levels of conflict and cooperation, as Kevin had noted. The contextual factors, the father's employment status, economic, as well as stability that often affects engagement with their child or their children. The maternal factors, co-parenting, the mother's adopt, a gatekeeper, attitude towards the father, which often access and expectations of the father's relationship with the child, and also the housing factors. A teen father who lives apart from the birth mother often plays a factor in developing a healthy and relationship and effective parenting. So if I could sum it up into one big ball, so to speak, the goal is to establish a non-judgmental space that allows young males to openly and honestly discuss the various dimensions of their social, emotional, paternal, and economic concerns.
Thank you, Kevin and Valerie. So insightful. It sounds like strategies that encourage supportiveness, flexibility, emphasizing the father-child relationship and the father as a man in that relationship, thinking about the context, housing, employment, where fathers are coming from, how they're treated in all of those contexts are really important to meeting their needs. Azar, I'd like to transition this next question to you. Thinking of your own experience, what services and resources do you think young fathers, including those who are non-custodial, most need?
I think, most fathers need a support system more than anything. I think my biggest pet peeve I had was when my child's mother modified our custody order. I received the papers in the mail. I read the papers, and then I went down to the courthouse. I went to the library help, I think that's what it's called, or something like that. I don't know what's like in other states. And they told me I had to go apply for a nonprofit lawyer agency to help me. And when I went to go apply for that income-based lawyer, they told me that they couldn't help me. So I was like, well, okay, now what do I do? I have less than 30 days to respond. I think it was already like 7 days in to me receiving an order from her that I have to go to court for my son. And now I'm stuck at a standpoint because I have my son back and forth between me and her, and then she modifies the order and they granted her custody at the time. So she had my son for a couple of months and I have 30 days to respond. I don't know what to do. So I ended up calling, all these lawyer places, and I'm hearing 10,000, 20,000, 30,000. I'm like, for a custody case, holy crap! How do I go about this? And how I got lucky was in my state, I lost my Medicaid. When I turned 19, I wasn't supposed to because I got guardianship, and I was supposed to get put on my family member's plan, but I never did. And so long story short was I ended up winning my case against the HHS for my Medicaid and the Supreme Court. And the lawyers that I had at the time who took my case pro bono knew other lawyers that could help me with my case for my son. And so luckily I got in contact with someone I knew, and I got a lawyer, which still kind of cost me a lot of money, but it wasn't as much as a typical lawyer because he seen where I was financially at and knew what was going on, reading my background and my history. But it was crazy because some of the places that I talked to as a father, I was in some trouble when I was younger, and they look at that and they're like, well, maybe this you shouldn't have him, or maybe, you know, things like that. I'm like, that's not fair to me that people will look at your background and what you've been through and kind of base judgment off of that, even with the judge we had at the time. So I think a lot of young fathers, you know, including myself, we get discouraged when we see paperwork like that, or even when she moved out and child support did come in, they came after me and they wanted me to pay like $500 a month for my son. Like, it's ridiculous when, you know, I take care of him. I pay for everything, like whether it's formulas, clothes, whatever it may be. And it wasn't about me paying for it, about the fact that I'm not realizing that I'm a father. Something I didn't have growing up, something I needed, something I knew I needed to be successful in my life. And they wanted to take that from me. And she wanted to take that from me, and just because we wasn't together. So I think, you know, getting that help, because they try to put us in mediation. Mediation didn't help me. You know, we argued back and forth in mediation, and she still wanted to go her way, or she wanted more of the time with him. And I'm like, why do I have to suffer based off of what your needs are? You can't be selfish for our child who needs both parents. I'm not going to be bitter in a situation because we're not together anymore, but we have to focus on what's best for him. And so we had to go to court route, and we're still fighting in court to this day. He's 3 now. So it's so hard that I grew up in a system and my son has to deal with the system now, based off of what we've been through. And she was in the system as well, my child's mother. So just, you know, having to play that system route or go that role, it's so unfair to everyone, because I feel like we should be able to make like men's, you know, meet based on not having to use the system. And I just think mediation didn't work because they were playing both sides of the ballpark. It wasn't really them trying to have us coexist or teaching us forms to coexist with each other. So I think a lot of fathers, they get really angry or upset that they know it's a one-sided show. They know like no one's there to help you. Like, even I was there with pregnancy, you know, I was there at the doctor's appointments. And when my son was had, they immediately went to my child's mother and excluded that I was there. They're like, oh, who are you? Are you like a friend or, you know, someone she knows or some person? I'm like, no, I'm the father. I want to sign papers. You know, I want to sit here and watch him, or I want to sit up here and know what's going on. And they kept excluding me out of everything. And I'm like, you know, you're not going to say something to me? And I'm like, I get this is not the narrative you usually see as a young Black father being in a room with their child, but I'm here, I'm present, and I need you to respect me as his parent and tell me what's going on. She's sleeping right now, she's asleep. I'm taking care of my son at this time, in this moment. So I think a lot of this stuff that goes on, fathers get discouraged because they don't have the means support mentally to deal with all the extra stuff they have going on. And no one is there to, especially if you don't have a male role model. If you don't have a male role model that is, you know, teaching you the means to be a man, let alone a father, that in itself is traumatic and PTSD and just very draining emotionally, because you don't know how to go about the situation. So.
Thank you, Azar. Wow, you touched on so many important points that I think resonate with a lot of folks on this webinar, between intergenerational trauma and not being treated as a parent or as an equal when it comes to parenting a child. So thank you so much. I want to turn to another really important challenge that we heard quite a bit about during our interviews and the convening. And that was really finding and paying for childcare, which, by the way, can be difficult for all parents. And it is often difficult for all parents, not just parenting youth in care. We heard during the convening that some young parents are eligible for childcare assistance, but navigating the application process can be difficult. The cost of care can exceed the amount of financial assistance young parents receive. Others may not be eligible for assistance for a variety of reasons that we heard about. And sometimes childcare that meets parents' needs isn't readily available. So Blanca and Azar, this next question is for you. What types of childcare do you think young parents in care prefer, and why is that? And Blanca, why don't you kick us off?
So I think this question really depends on the parent that you're asking. So like for me, on a personal note, I'm more comfortable with like the institutional type of childcare, you know, like a Head Start or things of that nature, where it's, you know, a corporation or something that like goes through an extensive hiring process versus an in-home childcare. Like you had mentioned, there's a whole list of reasons why young parents either have difficulties securing childcare or just decide to altogether not do it. I'm a mother of two. My kids are going to be 5 and the other one's 2. And I have never thought to put them into daycare, because you hear a lot of the horror stories on the news of, you know, either child abuse that occurs in these facilities or, you know, negligence or what have you. And sometimes that even happens close to home. I'm from Rhode Island, so it's a very small state and a lot of people know each other. And most people that you'll ask will say that they know someone or had that experience themselves. So to me, it was just a really terrifying kind of thought. When I eventually did decide that I wanted to kind of look into, you know, getting childcare for my boys, the application process was a nightmare. It's through DHS, so it's literally all what they see on paper. They don't really kind of do the in-depth look at things. They ask you like what your income is, and let's say you make $150,000 a year. They don't care that you have a mortgage, that you have a car loan, that you have insurance to pay, you know, car insurance, anything like that. They just look at what the total amount is, and that's the threshold. And for a lot of young parents, that's kind of a kick in the face, because, you know, we have all these different bills that we have to deal with, you know, buying our kids stuff for school, whether that's preschool or actual elementary school. You have your house bills, you have all these different bills that pile up as an adult. And for them to say like, oh no, you make too much, and it's just like, yeah, but like in reality, do I? Because that kind of just all goes to the wayside with being responsible. And then, you know, you kind of get caught between a rock and a hard place, because you're not able to properly find daycare, which also affects the ability to be able to find employment. For me, I've always considered myself to be in a very lucky position where I got married to the father of my children. So we're able to kind of switch our schedules off. But even then, it's still very difficult, because I'll have to work like late nights where he works during the day. And so by the time I get home, it's time to go to bed for me, and my kids are up at 7 a.m. So I think one of the biggest things really isn't necessarily to think of like what's being preferred by young people as far as childcare is going, but what kind of barriers can get knocked down to make it easier for them to select what childcare is easiest for them.
Yeah, absolutely. Thank you. Isar, what would you add to that, especially from the perspective of a father? Did you feel involved in the decision-making process around childcare? Do you have thoughts around additional challenges and barriers that enrolling your son in childcare brought up?
So my thing with childcare is, it may sound cliche, but I look at it as foster care system. And when I say that, I mean, it's another institution, it's another program, it's another feasible problem that you have that 9 times out of 10 doesn't get solved. Because it's like putting your child into a public school or you put them in a private school. Which one's better? Private school, you know, or Nelson Mandela, or something that's a means that you can't really afford. And a lot of parents want the best for their children, you know, learning, safety, nurturing. And a lot of these daycares in my state, it's just treated like a business. They don't really care about your kids. It's just another kid that goes into their system. They're getting paid for them. They, you know, my daughter, when we had her in daycare before our son was born, she came home with scratches. She came home with a bruise before. She came home saying she was hungry, and she went to about 4 or 5 different daycares. And I got fed up because it made me have flashbacks of being in foster care or dealing with people who just don't give a damn about you, let alone your children. It's just another dollar, because you make a lot of money in daycares. They make a whole bunch of money. So it's funny to me how these institutions say that they want to teach a child or you know, do what's best for them or nurture them the correct way. But when you get them from that place, they can't. My daughter couldn't even tell me what she learned. She didn't. She told me she didn't eat, or she told me someone's been mean to her. And then you bring those things up, and they play this role of it never happened, or maybe another kid did it. But even places with cameras or whatever, you know, they have dark spots in different places and things like that. And so my thing with daycares is I really like to do a thorough background. I really like to come in and, what was your job history? What did you do beforehand? Do you have children? If you got in a situation and this happened to your child, how would you feel? Things like that. I really like to make people feel uncomfortable when I'm speaking, because anytime you go into a conversation with someone and you feel like they're comfortable, that's not fair to you, because they're doing it in a means to like setting a quota or figuring out what can I do to get this person in the door. And I don't like no person that is like robotic to me, or I feel like they're not being genuine, because my type of person is, if we come in a room and I see you in sweats and a regular t-shirt and I'm in a suit and tie, I'm going to cling to the person that's in sweats and a t-shirt, because I know that this is you. This is what you're going to be like. This is how I know you're going to be for the day. As for you in a suit and tie, I know you're here to do business and then go home and you're going to take that off, and it's code switching. You're going to code switch on me. And I don't have time to play. I don't have time to play those games. I like to weave it out. Let me know what's going on. If it's going to go this way, then it goes this way. But if not, then I don't want to deal with it. And a lot of places sugarcoated a lot of things that went on in their facilities, and a lot of them got shut down. A lot of my friends took their kids out. So I think, for me, I'm luckily I get to work from home, based off of COVID and what happened, but also I work for a firm where they know that I'm a parent, they know I have my child, so they work around that schedule, which most jobs don't do, we know that. But I think a lot of places should really hone in, like when they say they can give a discount, that $10, $15 does not mean anything. Really trying to be accustomed to helping out families who really have, it was 8 of us. We didn't, my mom couldn't put all 8 of us in daycare. Some of us are in school, some of us stayed home, some of us stayed home to watch each other. And it was difficult for our mom to work, So I really feel like people should really like try to figure out, do fundraisers or figure out a way to get scholarships or extra funding, because it's a multi-billion-dollar business. It's just like any other place, and kids deserve to have the best, from whether you're poor, whether you're rich, whether you're middle class, whatever you may be. I think the equal opportunity is never there for children in any setting, whether you're older, younger, or grown like us.
Yeah, no, thank you. I think both of you touched on quite a few challenges and barriers to enrolling children in childcare that, again, all parents face, but some are magnified in your case, and things like the application process being difficult, cost being prohibitive, the type of care that you need to meet your schedule isn't available. And so this next question is really for Valerie and Kevin. What's currently being done to address some of these barriers? So what's happening right now, or what do you think are promising solutions to help young parents in care find and pay for childcare, and what additional help could be provided?
I'll kick this one off. I so appreciate the response that Bianca and Azar gave, because that is real, what you're experiencing and what you're feeling. And I can't tell you how many times I've heard this from a number of young parents. So with that being said, I am happy to say that there are a number of different opportunities young parents can take advantage of, but I'm not sure that they are aware of the opportunities. And I think we need to do a better job of making sure that young parents are aware of these opportunities. But one of the things that my agency is really big on, and it is a lot of different job readiness programs to help parents not only get a job, but keep the job, right? So there's a whole lot that goes into that. It's the dressing for success. It's the interviewing skills. It's all these different things that we focus on, and we don't just teach it. We give it. We make sure that they have the tools, the things that they need to ensure that they are able to get the jobs that are out there, and not just the traditional jobs in a fast food restaurant or something, but some of the other jobs that are being offered. Because like Azar said, equal opportunity is big, and we need to take advantage of that. There are a lot of agencies that now have case planners that focus specifically on childcare, and my agency is one of them. How what agencies are out there? What are the different type of opportunities in terms of funding that are out there? Sit with the young people, help them go through that application process, because it is a very huge, complex process, right? So a lot of agencies now are focusing on that with the case planners. But more than that, the part that Azar touched on of doing the research, we're working with young people to understand what that research should be. Not just the name of the child care, but what are some of the comments that are out there, commentary that are out there about the child care? Do they have, I remember when, I was going to school, my mom and dad did surprise drop-ins. Do they allow you to do those surprise drop-ins so you can see what's going on at these daycares, right? Because you all know if you tell them they're coming, the best of the best put their best foot forward. So if you're doing a surprise drop-in, what will you see? Understanding what all of this is about, but more than that, I think just having the opportunity to, get the different jobs, the different state funding, and also more state-funded daycares that are rated by the state, right? Because why have these different childcare opportunities if the child has to be waitlisted until they can actually get into the program, right? So let's provide more of these state-funded daycare opportunities that allow these vouchers, so to speak, that are so hard to get, right? That's another issue. Why are they so hard to get? They're supposed to be there for our young people, right? So I think in a nutshell, we have to focus on educating our young people, assisting, supporting, and allowing them the opportunity to feel comfortable, because it's not easy just to stick or to place your young person into childcare and then go about the rest of your day. It's not easy, right?
Yeah, thank you, Valerie. Here in Illinois, what we have done and what I'm hearing today is two very significant barriers: cost and trust. And we've really tried to take those on by, frequently we hear about kids missing work and missing school because of daycare. And we know that for us, we're constantly moving youth towards work and school to achieve self-sufficiency. So for our parents, what we've set up is they don't have to go to an outside agency to find subsidy. We subsidize daycare for our youth in care who are working in school. We subsidize protective daycare for our youth who have mental health or substance abuse problems and our parents, or who have had child protection involvement. We subsidize daycare. And for youth who are not working in school, we subsidize 2 days a week of daycare for them to go out and seek opportunities to find employment or re-enroll in school, with the hope that they will lapse over to full-time daycare subsidy. Now, we really believe that the choice to place your child in daycare is one of the most important decisions that a young mom makes, and that needed requires the assistance from the caseworker and from the child welfare system. And we've engaged in a required process for all our caseworkers who serve expectant and parenting youth of a process called community mapping, which means they look at the zip code where the youth lives, they explore resources, a full range of resources, but for what we're talking about now, childcare resources, and that they actually, caseworker and youth visit, that the caseworker accompanies the youth to visit that daycare center so they can embed trust, so they can ask questions, so that they can get back in school in a timely manner, that they can continue their employment goal, and that they can feel supported and encouraged and guided in the decision. It's such an overwhelming decision to make, whether you go home or whether you go a childcare institution. Those are all really tough decisions, and there's a limited resources. Is it on your bus route to work or school? Do you have to get on another bus to then take your child to daycare and then get to school? And will you get to school on time? The decision about when, where, how, and who will pay for it are such significant barriers that what we've tried to do here in Illinois is eliminate some of those barriers to making sure there's an easy application process and that there's assistance with that decision. And that the permanency worker, their caseworker, really guides them and escorts them around the community to find those resources and comes up with a plan.
And if I can just say, a lot of schools are really trying to get on board with assisting young parents in getting back to school by offering life programs in which the kids are actually in the school daycare while the parent actually goes to school. And I think if we can get more schools involved in this idea of holding a life program, I think we can get more of our young people back into school, because basically they drop the kids right there at the school while they attend school for the day.
Yeah.
Yeah, thanks, Valerie and Kevin. It sounds like there's a lot of promising solutions in there, and a key feature among all of them seems to be trying to address some of those barriers we heard about, whether it be scheduling, cost, the application process, addressing what young parents want, their preferences for care. So thank you. Yeah. I'd like to transition now to thinking about another topic that we heard quite a bit about during our interviews, and that's on supporting young parents' mental health. Becoming a parent is a life-changing event, and we heard during the convening about this dual transition that expecting young parents have to navigate. That's the simultaneous transition to adulthood and the transition to parenthood at the same time. Normative experiences like postpartum depression, feelings of isolation can really be exacerbated without a support system in place to help youth along these both tough and exciting transitions in time. So Blanca and Azar, this question is for you. What are some of the barriers that prevent young parents in care from seeking out mental health care services? And how do you think those barriers could be addressed? Blanca, why don't you start us off?
So I think the biggest and most important barrier is stigma. A lot of times us as young people who have lived experience within the foster care system already have a lot of odds stacked against us as young parents, whether that be people not believing in us, thinking that we're gonna, something's gonna happen with our children where they'll end up with the same system involvement as we did. There's a list that goes on and on and on and on. So I think that's really the biggest barrier, is having that stigma. So a lot of times what young parents with lived experience end up doing is that because of that stigma, we don't seek out that mental health care, because we're either scared that our kids are going to get taken away from us because we're deemed to be unfit parents, or we'll lose custody of our children to our significant other or the other parent or what have you, because again, being deemed not to be a mentally fit parent. I think that there needs to be a lot more conversation surrounding mental health in general, but specifically with young parents that have lived experience. I think that oftentimes we forget that young parents who have that lived experience or are still in foster care, what the case may be, don't have the same supports as like parents who don't. I again mentioned my husband has no lived experience within the foster care system whatsoever. And he's got a very strong support system. He's got his family to rely on and things like that. I, come from the foster care system, was closed out to the department at almost 18. And I don't have a support system. I have one sibling that I can call on, but it's never, if I have a case of emergency where I can be like, hey, can you come watch the kids for the day? Like I have an appointment that I have to get to, and, my husband's at work. So I think oftentimes we forget that piece of it. And then the part that kind of makes it even worse is the fact that, like, if you tell your primary provider, for like your doctor or whatever, like, hey, I'm struggling with some mental health issues, what can I do? The blanket term seems to always be like, okay, well, let's get you on medication. And I speak of this from like my personal experience. I recently started trying to seek help for my own mental health, was immediately put on medication. There was a referral given out to start seeing a psychiatrist. And the referral never, like, nothing came of the referral. And when I brought it up to my primary care, the response was, well, everyone's struggling during COVID. And I think that that's never the right way to approach it. Like, we all know everyone is going through it, it's COVID, like no one's got it easy. But I think having that to be a response to someone who is openly telling you, like, I'm struggling with mental health and I need the help, is really kind of the way that they look at it. And it's just like, wow, well, if they don't care, then why should I even bother trying to seek help for these issues? Primarily in the realm of young parents, I know here in Rhode Island, we've had lots of situations occur where young parents will seek out mental health services, and immediately they bring in the Department of Children and Families to make sure that everything's okay at home, quote unquote. And then they find a reason, whatever it may be, to stay involved within that family, even though that might not be necessary. And as someone who's experienced the trauma of being ripped away from their family on more than one occasion, that can be super traumatic and worrisome to a young parent who doesn't know what their primary goal is. They may say like, hey, it's to help you out so that we can give you some resources and services, but the young parent is looking at it as, well, you guys took me away from my family and never gave me a reasoning why. How do I know that you guys aren't going to do that to my children? So I think really it circles around the stigma, but also just having, I think really that trauma-informed notion, so to speak, where you can see someone and take what they're saying as far as their mental health concerns are seriously, and not involving social workers or, big power players, as I call them, within the system.
Yeah, thanks so much, Blanca. And I think you kind of started to circle around another topic that we'll hit soon around increased surveillance and all of the fear that goes along with that. What would you add, if anything, to thinking about the barriers of young parents reaching out for support around mental health and how they might be addressed?
System plays a part every time. I really want people to think about this, everyone. I grew up listed as a high-risk child. Never understood why. Never knew the means of it. Never in my case. Never even read why I got taken into foster care. And I told multiple homes that I got mistreated in. I just want to be a kid, go to school, graduate, and get the hell away from y'all. That's all I want. I don't want to be a problem. I don't want to make things worse. I don't even want to be at home anymore. Y'all didn't ruin that for me. And the fact that every child that comes to the system, we are not treated like human beings. We are treated like a number, a data, or a statistic. And it's about where you fall at in that damn road. And that is so messed up. It is so traumatic. It is so emotionally disturbing that you can't even find peace. And they tell you that they're bringing you somewhere that's supposed to be peace, that's supposed to be safe, that's supposed to be better for you than you were at home. So mentally, you come in already broken. Physically, you come in there already messed up. And then you have somebody selling you a dream, a narrative, imagination of a perfect world that is not going to happen. A world of it's going to be okay, and you're already not okay. And instead of someone coming to you with some emotion, without a piece of paper with your name on it, listing things about you, someone telling you that, do you know why you're being taken? Someone just pestering you to answer them when you have no answers on what's going on with you. How do you mentally state what's going on? How do you physically be present anywhere when you've already been distraught from being taken out of your home, from being taken from your siblings, from being misplaced from home to home as a misfit? And they telling you that that everything is going to be all right, that you're going to go home. You're already being fed lies. So my biggest thing with any worker, anybody I've ever worked with, the notion of what were you like when you were a teenager? What were you like when you was a child? Not everybody's perfect. Don't call me that shit, because nobody is perfect. And so you need to think about when you say you don't want that teenager, you don't want this kid who has anger problems, you don't want this kid that may be aggressive, no one asks why are they acting that way. It's the notion of, let's get them some medicine, let's throw them in therapy, let's send them to a new home, let's split them from their siblings, let's take away what they already know and just misconstrue it, just miss everything, like they just mess everything up. And you expect a child to be okay. You can't expect them to be okay when you've already taken what was already taken from them. All you did was make it worse. And then you have to go and be like mentally broken again, because now you want somebody to empathize with you and try to relate with you, but they can't because they never felt those shoes. And so it's just a whole pity party. It's just people sympathizing with you, and you don't want no one's sympathy. I already know I'm broken. I already know my life is hard. I already know things are messed up. I already know I'm not okay. I don't need you to tell me this when I know it for myself. I don't need you to keep on making me feel like I don't belong. I don't need you making me feel like I'm not a human being. I don't need you to make me feel like I'm just your piece of paper that you have to deal with every single day. Make me feel wanted, make me feel comfortable, make me feel like I mean something to you, so I can get closure somewhere. But you never get that closure because whether you're bouncing from provider to provider or home to home, you've never found that home within a person, a worker, or yourself, because everything is a house to you. And what do you do in a house? You give it some time, you mess things up, you try to make things better, and then you move. And so you keep that wave going and going and going until you hope that it comes to a stop. That's your best emotion you have, is hoping one day that it comes to a stop. But no child ever feels like that. It just keeps going.
Wow. Thank you so much. I think everything that you just shared completely speaks to the lack of any type of trauma-informed care and services, and a huge gap in the field in general around supporting mental health needs. And it actually goes right into our next question, which is a theme that came up around specialized training for caseworkers and foster parents, and that we heard during the convening so much about how, like in most jurisdictions, caseworkers don't necessarily have training about the special needs of youth in care, parenting youth in care. And they have youth of all varying needs on their caseloads. And consequently, young parents are typically assigned to caseworkers who have not been specially trained to address their unique needs and necessary supports. Valerie, and why don't we start with you? What types of specialized training do caseworkers and foster parents need to better able support youth in care and parenting youth in care?
Okay, so this is something that's near and dear to my heart. And I just want to thank Bianca and Azar once again, because this is the reason why I do this work that I do. I worked 30 years in the financial industry. I worked for a large financial firm for 30 years. And I decided that I needed something more. I wanted to give back to young adults and do something different. And I wanted to be different and make a difference. So when you talk about specialized training, of course, there's always the trauma-informed care, the trauma-informed training. That's first and foremost, because, you know, a lot of young people, when they come into care, there's some sort of trauma that they are dealing with, okay? Whether it's separation, as these two young people, you know, noted, or whatever it is, there is trauma. So yes, you have to have some sort of training in order to understand what is trauma, what are the different types of trauma, and, you know, so that you can be able to have that tool set when you're dealing with young people. But we got to take it one step further, because we can do all the specialized training we can in the world, but the real training comes from your heart. Okay. And it's like Azar said, you got to understand that if you're in this type of role and you are wanting to make a difference with these young adults who are coming in with all the different type of issues and trauma that they have, where's your compassion? Where's your understanding? Where's your meeting them where they are at in order to bring them forward? Because if you can't meet them where they're at and you can't understand that they are dealing with so many different issues and so many different concerns, and if your heart is not there to help them through what they're going through, you're in the wrong job. And that is why I took this job, because I myself was able to make a difference for young people and just meeting them where they're at. When they came into, I actually, oh goodness, excuse me, I actually ran a residential program for pregnant and parenting young women. And when those young women came in, okay, it was always that, okay, yeah, you're just another person here, you're here to get a check, why should I listen to you, right? So it took a lot of that, breaking that barrier, breaking through, understanding that, it's not me that they're mad at, it's not me that they have the issue with, right? But how can I get them to not just trust me, but to understand that I'm not going anywhere. I'm here. I'm going to see you through this. I'm going to help you through this. Anybody that works for me is going to help you through this, right? And that's actually having, meetings with my staff, on a weekly basis to say, what have you done different? What difference have you made in a young person's life today? What happened today that you can, say that you're proud of with this young person? It's all about that compassion, that understanding, that meeting them where they're at, and it's also about knowing that it's not always going to be this real big happy medium. There are going to be some trials. There are going to be some issues, right? There are going to be some times when they get upset and want to just blow up the place, right? But in your understanding of the fact that these are human beings, these are young people that are going through some issue, some trauma. And if you can break that mold or make that connection early on, it will help build a better relationship. So yeah, we can do all the training, specialized training in the world, but unless it's coming from the heart, it won't make a difference. Kevin?
Oh, yeah, thank you. I totally agree with what everyone has said today. I can talk a little bit about what we've done here in Illinois. I mean, we are a very large state, covering everywhere from the Wisconsin border to the Missouri border, Iowa, Indiana, with 102 counties. And we have right now about a little over 400 pregnant and parenting youth in care. And we know that to randomly assign them a caseworker who's never been trained or doesn't have any experience in understanding how to serve young moms doesn't work for us. So what we've employed here is about a 12-module training specifically for caseworkers that have a caseload of pregnant and parenting youth. And this makes us assure that everything that we've embedded in our practice and in our policies, that those workers are trained in that. So how to maneuver the child care system, how to do community mapping, how to do improved discharge planning for pregnant and parenting youth, how to engage with family members and paramours and partners, how to be strength-based in working with fathers. All of these, we have this 12-module topic that we really try and push in caseworkers and really assign our young parents to those caseworkers so that we know that they have the knowledge, the skills, and the training to provide the casework services and the support they need. We also do, a few years ago, we started what we call risk reduction training for teen parents. So we have every teen parent in the state goes through a 2 to 3 hour safe sleep training that includes how to find childcare, how to choose appropriate caretaker, how to, we teach young moms how to detect unusual bruises or marks on youth when they come home from other caretakers. and how to set up a crib, how to avoid co-sleeping, how to, if you're going to leave your placement, take a pack and play to have safe sleep. So we try and bring trainings directly to the youth also. In addition to that, all youth in Illinois go through financial literacy training, about an 8 to 10 hour basic financial literacy training about how to prepare a budget for your family, how to invest, how to save your money, how to open an account, how to have a relationship with a bank, how to open an account for your child. So we see training here as a really important piece of the puzzle, and as really in employing a specialized group of professionals to serve these youth.
Thank you, Kevin and Valerie. I love the way you both actually just shared a little bit more, because Kevin, I think you had a lot of the logistical things of how specific services and supports are addressing some of the barriers we've heard about today. But Valerie, you really sent home the message that if it's not coming from a place of compassion, it's not going to be as useful. And it's always important to think about a person first approach in all of these services. So thank you both. I'm keeping an eye on the time, and I want to direct one more question to Blanca before we actually start wrapping up and get last thoughts from everyone. One topic that we didn't really get to discuss much during the convening, but that the audience really wanted to hear more about, was that of equity and inclusion for all parenting, youth, and care. And we heard that some young parents felt like they had less access to services they needed compared to others. Specifically around inclusion, we heard that young parents frequently excluded from the decision-making process where decisions are being made that affect their lives and the lives of their children. So Blanca, to start, how equitable is access to services for parenting, youth, and care? What could be done to make it more equitable, and what are steps that we could take to increase, lift youth voice and increase inclusion?
So I think the biggest thing to kind of keep in mind is a lot of times when it comes to youth and care, we don't really know how to navigate the systems, especially when it comes to any type of assistances, whether that be, for medical, for, food services of what have you. We don't really know how to navigate those systems. And, what Azar and Valerie both mentioned about having people that genuinely care and have that compassion, are willing to really work hand in hand with the young people, I think is key. So I think that's like the basic, right? I think the second kind of tier to it that makes it so that services that are available to young parents normally, that, just because you're a former foster kid, you don't really get access to, falls along the wayside of, well, you shouldn't have gotten pregnant to begin with, or what have you. There's a huge stigma around, well, if you need to be on welfare, or if you need to apply for help through welfare, then maybe you shouldn't have had a kid. And a lot of people don't understand that you may be fine, like, one day, and then the next day things happen, and it might happen where my mom used to call it a fall from grace, essentially, where, you just lose it, and you don't have the supports that you had in place at one point, or you don't have the ability, you lose your job, what have you. And you need to rely on those supports to be able to appropriately care for your children. So I think that's another part of it. I think one of the things that DHS, at least here, is doing a lot better of is that they're getting rid of having so many like judgmental people behind the desks, and inviting more of that compassion. So people are more inclined to really listen to the story, as far as like, oh, okay, well, I see that you used to make, X, Y, and Z, and you used to have a job here, and I see that now you're not, like, what happened? And actually genuinely listening to, well, I lost my job because COVID shut it down, or, I couldn't work because my kids had to stay home for COVID, and now I'm in need of this assistance, blah, blah, blah. And there being a lot more opportunities. I think the biggest thing, and I will say this till I'm blue in the face, as far as being able to help young parents, especially those with lived experience, to have equitable access to things, is to listen to them. A lot of times we know exactly what we need. We just don't know how to go about finding it, or even applying for those resources, or, like how to maneuver challenges. And a lot of times it just takes that one person that's like, okay, I hear you. You're having trouble with applying for childcare. Well, you know what? There's this program that you can go to. You can fill out this form, and they will help you to find the perfect placement for your child for childcare, or be able to give you a stipend so that you're able to still continue paying your bills despite not having childcare. So I've always said it, and I will stay saying it. I think listening to the young parents is really the best way to go as far as any issues that come from being a young parent with lived experience.
Absolutely. Thank you so much. I want to make sure we hear from everyone at least one more time. And so I'm going to pose this question to the group and we'll just go around. If you could have the audience take away one thing from today's discussion, knowing that these are researchers, policymakers, those who are working in direct services with expecting and parenting youth. So thinking about that audience, and these are folks who are interested in you and what you have to say, what do you want the takeaway to be? Let's start with you, Kevin.
Wow, thank you. What a loaded question. That we have a responsibility and an obligation when we work in this child welfare profession to assure that youth who come into our care or we're responsible for and become parents, that we have an obligation and responsibility to make sure that they have the supports and services to be the most successful parents that they can be, to be a family unit, to be maintained as a family unit, and to stay together, and to allow their experiences be free from discrimination, be free from bias, and that they have services and placements that are going to help them be the best parent they possibly can be.
Thanks. Valerie, how about you? What would you want the main takeaway to be today?
Well, I think Kevin said it well, but I think Bianca, you said it, Azar, you said it even better than Kevin and I could say it, right? Let's listen to these young people. Let's have more of these type of forums that we were so fortunate to be involved in today, because that's where you're going to get the answers that you need to these type of questions, right? No one knows better what someone is going through than the person who actually is going through it, like Bianca and Azar. They can give you the information you need to make these experiences that these young people are dealing with less traumatic, so to speak, right? So if it means that we have to open up more of the forums that the urban care did, or if it means we open up more daycares, if it means we get more compassion in the type of people that we deal with on a daily basis, then this is what we have to do. Because if we're saying that we want to have a system that has a more productive, more robust feeling for young people and not more of a traumatic feeling, then we got to listen. I mean, I am fortunate to work for an agency and a assistant vice president that allow us to never give up. Like, once a young person leaves our agency, we follow them. We keep up with them. They can contact us if they need something, if they just need some support, whatever it is. We're there for them. I don't care if they're 25, 35, 40 years old. We stay with them. But not all agencies are able to do that. So let's get some more agencies involved with sort of the aftercare, so to speak, because that's huge also. But I think the best thing, and Bianca, you said it better than I could ever, let's listen. We have to listen.
Azar, what would you want your takeaway for the audience today to be?
Don't let my words fly over your head. Really hone in on what I said, and I don't speak for my health. I don't speak for my well-being, but I speak to remember, and I speak to have an everlasting impression. Whether you talk to me today or you never talk to me again, you will remember my name and who I am and what I've done. And I will make sure that I'm always present in your life. Another thing is researchers and workers in this field always remember who you are, stay true to yourself, and remember what I said. At one point in time, you was a teenager. At one point in time, you was a kid. You don't have to have the experience in order to relate, but I know you might have a friend or a sibling or a parent who has experience, whether it's trauma, PTSD, neglect, a negative situation. Really hone in on that and realize not every person has to put they're not going to put their foot forward, but if you do and you actually try, then and you keep trying and show you're persistent doing this work, that child or young adult or young parent will put their foot forward with you. So really try to clash in harmony is what I tell people, because we all are perfectly imperfect. It's about trying to perfect those flaws, even though they're imperfect, and really show you care, show you love, and be genuine. Just please be genuine in what you do, and let us feel that. Don't be perfect with me because I'm not perfect with you. I'm a very vulnerable young man. I am very sensitive, and I hone in on that. So giving people those characteristics and letting them know those things, instead of being that piece of paper that you use or you have to work with. I get you need it, but at the same time, you don't need it, because if you're you in a situation, it's going to make someone connect with you on a whole nother level. It'll bring more vulnerability to the space. It'll bring more comfortability to someone else, and it'll make you feel better and bring peace to you, knowing that you tried genuinely, wholeheartedly, and respectfully to this young person.
Thank you. Yeah. Blanca, you want to finish this up?
Sure. I think for me, the biggest takeaway that I would want everyone watching this to go away with is that just because we have lived experience doesn't change us from being the same, loving, caring young parents as anyone who doesn't have lived experience, or even, non-young parents. I think that a lot of times we kind of get overlooked and stuff like that just because we have that lived experience sort of tag on us, and that's not fair to a lot of us who are trying. And I've said this a couple of times in different presentations that I've given, but a lot of people think because we have lived experience that we're not meant to be parents, or that we're not meant to be good parents, or doomed to follow the same mistakes our own parents made with us. But in reality, we kind of use that lived experience as a drive to be the best parents we can be for our kids. And having all these barriers and struggles and difficulties in the way that could just as easily disappear like that with just having the right people and the right conversations, just makes that a lot harder. So I think, listening to the young people, bringing in the appropriate people into those conversations, young fathers, young mothers and fathers of color, anyone who's underrepresented in specific communities, having them at the table, listening to them, not tokenizing their conversations, and just being like, yeah, we check that tally off. We have a young father of color, we have a young mother of color, or a young Indigenous mother, whatever, actually having them be part of the conversation and the solutions to go forward.
Wow. I know you're getting a huge round of virtual applause from our audience members. Thank you all so much. You're fabulous. Thank you for taking the time to share your insights, taking the time to chat with us today. For the audience, we will be releasing a research brief that culminates all of this work in the coming weeks. So please do keep an eye out for that. Our events team just put a survey in the chat box. If you could take a minute or two to fill that out, we'd greatly appreciate it. The recordings and slides will be posted on the event page. Again, feel free to share with others, and we hope to see you all again very soon. Thanks so much.